You kind of have to be a little bit kooky to be into infectious diseases anyway. It was quite a happy ward, I think, a very strong team. Compared to now, it's a bit of a daily grind, really.
Nurse Grace Carroll spent 2 years on the front line of the COVID pandemic at a major Melbourne hospital. But she says things are even worse now.
I feel like it's busier now than it has been ever. Every morning you come in and there's at least 100 patients in emergency. That's day in, day out. So no, definitely the pandemic's not over.
We've got this perfect storm of staff shortages, increased demand that we knew that was going to come, and then also significantly increased demand in terms of COVID and flu.
Now is not the time to get sick in Australia.
I would describe what's happening right now as a crisis. I work in the emergency department, and our emergency departments are absolutely overflowing. But the problem is that we can't move our patients out into hospital beds that have enough staff working in them to look after patients safely. And because we can't move patients out, we can't offload patients from our ambulances, who are then ramped outside our hospitals for many hours and can't respond to patients that they need to see in the community.
Nowhere is immune to this crisis. Most states and territories aim to get 90% of patients out of ambulances and into care within 30 to 40 minutes. Last year, not a single one reached that goal. The ACT, Western Australia and South Australia were the worst performers. And in Victoria, ABC News recently revealed up to 1 in 5 patients last year just gave up and left the emergency department without treatment.
It's just been relentless. Any patient that you discharge, there's 3 waiting in emergency to come up.
Nurse Grace Carroll has already had COVID twice, but last month she had to take leave for a different reason. Burnt out and exhausted, she was finally tipped over the edge when she was abused by a patient's family.
I just couldn't stop crying, like sobbing, crying. We are short-staffed and we are working so hard, but when you keep cupping that every day, you're going to break at some point.
She's not alone. Report after report has found staggering rates of burnout among Australian healthcare workers. One study during the pandemic of over 9,000 frontline healthcare workers found 57% of the workforce was struggling with depression, almost 60% anxiety, and 70% moderate to severe burnout.
I can't see the end of the tunnel, that the resource is being able to compensate for the increased demand. The issues have always been there before COVID. However, COVID has really shown what the cracks are systemically.
Sydney nurse Hayley Chandler has made the difficult decision to leave the industry after working throughout the pandemic.
Feeling burnt out, you obviously sort of bring those emotions home, and I also felt quite bad in talking to patients that I felt that I wasn't giving them the level of care that I would like to give, just simply because I was stretched to my absolute thinnest.
She's now studying law and believes others will leave the industry unless something is done to fix workforce shortages and huge workloads.
People are going to want to look for work elsewhere because they're going to want to be adequately supported within their workplace and feel as though they're safe at work.
Practitioners are all thinking, why am I doing this? It's not actually good for my health and may in fact be dangerous.
After 30 years in medicine, Professor John Wilson is joining the exodus. He says he could no longer work in what he describes as a failing system.
Healthcare in Australia has been taken for granted. It'll always be there, but that can't happen anymore. We're not in a situation where this could get worse. It is worse now.
We need the funding that's been put into COVID from the federal government to the states to be extended right now. We need that tomorrow. Long term, we need a commitment for federal government to fund 50-50 the public hospital systems, and we need to remove all of that 6.5% cap.
In a statement, the new Federal Health Minister said he'd work through the issues with state premiers. 730 also reached out to all state and territory health departments. Most acknowledged the serious pressures their staff are under and detailed their plans for addressing workforce shortages. All urged their staff to seek support services if they were struggling.
We know that the stresses of medicine have really significant implications on the mental health of junior and senior doctors right throughout the system. So the increased stresses that the health systems that they work in are under, you can only imagine what that's doing to their mental health.
When you have long hours, the night duties, and also the social isolation that arises because you can't plan a social life easily. That combination of things are all risk factors for mental illness.
I'd like to show you Tasha's room.
Indrani Tamanason knows the extreme consequences of the pressures healthcare workers face. Her daughter, Dr. Tasha Port, died by suicide in the first year of the pandemic.
Tasha is not defined by her depression, and I do not wish her to be defined by that. But her illness did kill her, and for that reason I feel we need to keep talking of who she was and how she died, and hopefully with that we can change things for the better for others.
Tasha, a third-year junior doctor, had a long battle with depression and the stigma that surrounded it.
We believe the reason was that she felt she couldn't get into the paediatric program. But if you had an environment that didn't have all those risk factors worsening her mental health, would she have got to that point, putting her in the pain that she must have been in?
And we've got all the photos of her in that last year or so.
Dr. Tasha Port's parents have just marked 2 years since her death, the hardest 2 years of their lives. They want the system to better care for those who care for us.
I really do want to talk about how we can change working environments to make hospitals and doctors and a profession of medicine which is supposed to be caring and compassionate. I want it to be more caring and compassionate for its own community.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.